All right, chapter 38, the physical examination. So in chapter 37, we talked about positions that you put patients in for examinations. We talked about different things that are required to start the examination process. You have to ask the questions, you have to do the patient interview, etc. Get their vital signs. That's chapter 36. In this chapter, we're going to talk about the examination itself. So be aware, as medical assistants, we cannot examine, okay? All we do is assist the physician. We don't examine the patient ourselves. The physician examines the patient, but then gives us directives as to what we need to do from there. So the complete physical examination determines the general state of health and well-being of the patient. It's performed for various reasons. Sometimes it's for physicals. Sometimes it's because the patient has an injury or is ill. It covers all major organs and body systems and is performed by the provider themselves because MAs do not examine, right? Okay. So what is our role as medical assistants? So our role in the examination is to prepare the room, the equipment, and the patient, and position the patient. We learned all of those things. We learned that you have to clean the equipment every time. We learned that you have to how to position the patient for certain examinations. Something else cool that we get to do as MAs is we get to assist the physician in the procedure or the examination. We get to hand them instruments. We get to watch them perform the procedure or the examination. Providing the comfort to the patient. That's something else because your patient's comfort is really important. If they're not comfortable, what happens? They don't want to be there. They tense up. Maybe it alters the results of the examination because they're not comfortable. They're scared. Maybe they're not cooperative, etc. So it's really important that medical assistants are there to ensure that the patient gets some kind of comfort from you while they're in that uncomfortable situation. Scribe. To scribe is to write what is said, to document what is being said. In this situation, medical assistants typically would document on a computer. I know if you go to an eye doctor, there's an MA or an like an assistant for an eye doctor that'll be there typing as the doctor's talking about what your results are. If you go to a dentist, there's somebody usually typing in there what your dentist is saying about this tooth and this tooth and this tooth. That's scribing. And a medical assistant should have basic knowledge of all history and physical procedures. Techniques. So there's different techniques in a physical exam. The first is inspection. The second is palpation. What is inspection to you? So like inspection to me is to see it and to like observe it, right? Would you agree with that? Yeah. Palpation, what are we doing when we palpate something? We're feeling it, right? We're putting our hands on it and we're feeling it. Percussion, what's percussion? Listening, we're listening for sounds. We create, so like percussion is where we tap, 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 and then we listen for the type of sound that comes from that tapping. Have you ever had your doctor like tap on your face to see if there's pressure in your sinuses? That's kind of like percussion. And then auscultation is where we're listening for different sounds. So when they put their stethoscope, the doctor puts their stethoscope on your chest and listens to your lung sounds, that's auscultation. Mensuration. What are mensurations? Where do we know that word? They're vital signs, right? Height, weight, pulse, respiration. I can't think. Height, weight, pulse, respiration, blood pressure, pulse oxygen, saturation, stuff like that. And then manipulation is where we take the object and we move it, whether it's an arm or a leg or whatever, and we manipulate it to see if there's sounds in there, any crepitation from a broken air joint, or if it's got a limited range of motion, etc. So the format of a physical exam, general appearance is your inspection. How do they look? Do they look kind of gray? Do they look kind of green? Do they look sad? I mean, how do they look? I look at you and you all have great like pink skin, like you all look pretty healthy. You know what I mean? It's just an observation can tell you, an inspection can tell you a lot about somebody just by looking at how they look. Skin, we inspect it or we can feel it. If there's a nodule or something that would require being felt, that's obviously something palpation would be for. But you can generally tell a lot about a patient judging by their skin. What does it look like? Is it bumpy? Is it, like I said, kind of like gray? Is it really like wrinkly, like maybe the patient's dehydrated? Is it red? Is it inflamed from some kind of infection? Is it open because it's cut? There's a laceration there. That's what that's kind of referring to. The neck, you look at the neck, you palpate the neck, you listen to the neck, and you can move the neck. Those are things that get done in a physical examination, okay? HEENT, head, ears, eyes, nose, and throat. That's what that stands for. You inspect this and you palpate this. You tap on the face. That's percussion. You can tap on the sinuses if your patient has a sinus infection, maybe. You look at it. You look in the eyes with the ophthalmoscope. Let me get my ophthalmoscope out here really quick. You look in the eyes. You can look in the ears, right? That's inspection, okay? So when your patient comes in and you need to look in their eyes, you would get out an ophthalmoscope, right? And you would, the doctor would, you don't, because MAs don't examine, right? Just physicians. And they would put it up against the eye, and they would look into the eye to make sure there's nothing wrong there anatomically or whatever. And then they would also look in the ears with an otoscope, because oto means ear, right? And ophthalm means eye, right? So then they look inside the ear, make sure that the tympanic membrane is intact and there's no inflammation, there's no fluid, et cetera, et cetera. So I'll let you look at those later on today. Okay, but the throat, they also look in the throat. They use the tongue depressor, push your tongue down so they can visualize. Okay, and then the nose, they can use the same tool to actually look up the nose so they can see if there's turbinates that are infected or inflamed. And then ears, eyes, nose, throat. Yep. And then the head, they can feel the head, make sure there's no lumps, bumps, or anything like that. The chest. The chest is inspected or palpated. So a lot of times we can feel in the chest cavity if there's inflammation. Inspection, we can just visualize the chest, watch the breath. Is it up and down? How are they breathing? Is it fast? Is it slow? Et cetera, et cetera. Heart, we listen to the heart. Why? Because we can't see the heart, can we? We can't see the heart, so we have to listen to the heart. What do we use to listen to the heart? Stethoscope, right. The lungs, we listen to these and we can actually percuss these as well. So you can't see them, so you have to listen to them. The breasts, we inspect or palpate, and I will be showing that to you today as well. And then your abdomen, we would listen to that, we would inspect it, we would push on it, and we would tap on it, okay? So your abdomen can be listened to. They listen to your stomach to see how the digestive juices are breaking down food and processing things. They inspect it, they look at it to see if it's distended. Is it swollen? Is it shrunken in? Palpation, you're feeling for excess stool and the intestinal tract, or they're tapping to see if there's pain in an area, like maybe your appendix is going bad and you tap on that or push on that area and it sends you to the roof because it hurts so bad. The back, inspection, palpation, and manipulation. Obviously, if you have scoliosis, you'll have been inspected, palpated, and manipulated quite a bit in your life. So they look at it, they feel it, and they move your back to see what kind of like how it works. So what's it doing? Is it functioning correctly? Genitourinary and rectal, for males specifically, they inspect or palpate. So for males, during physical examinations, what they do is they feel the testicles to make sure there's no lumps or anything abnormal, like maybe that could be cancerous or very dangerous. Visualize looking at it. Is there an infection, et cetera, et cetera. For female, it's genitourinary and rectal inspection or palpation, same thing. It's a visual process. They might take a sample if you're doing like a Papa Nikolai smear, which is a pap smear, where they test for cervical cancer or abnormalities in the female reproductive tract. So, physical examination format continued. Extremities, mensuration and manipulation. What are mensurations? Vital signs. Yep. So we're going to check and make sure your extremities are functioning and there's good oxygen flow going through there. And we're going to move them around to make sure that their range of motion is adequate. Muscle strength. Patients perform a set of movements that the provider counteracts with resistance. Have you ever had a doctor tell you, go ahead and push against me? And if they're checking to see what your muscle strength is, do you have the ability to push, okay, or to pull? They do it with legs and arms. Reflexes, percussion. So we're going to take a percussion hammer and we're going to tap it on your knee to see if you have a reflex, okay? Questions so far? There's the Romberg balance test, which is performed to detect any muscle abnormality. And then there's coordination tests. As MAs, we will never do these, but physicians do these as part of their examination. And then here's their assessment or plan. You remember SOAP? What does SOAP stand for? Subjective, objective, assessment plan. So the patient comes into the office, they tell you something is wrong, that's subjective. You do your part and you take their vital signs, then it becomes objective. And then the physician sees them, checks them over, does their examination, that's assessment. And then they come up with a plan as to what they're going to do to help the patient, and then that's the plan, right? So the documentation of an exam, many providers use a POMR. Providers make assessment based on health history, findings in their examination, and other procedures and lab tests. Plans may include diet, exercise, physical therapy, medication, or surgery. Those are all things that are done to fix something that's wrong with you. As a medical assistant, it's your responsibility to check the chart to make sure that you get everything ordered that needs to be ordered. So if the patient needs a CAT scan, you need to make sure that gets set up, and that once it's completed, the results get put in the chart so that the physician can use those results to better assist that patient. You also are responsible for setting up appointments with specialists for the patient. So if your patient comes to you and they need to be sent to a general surgeon, excuse me, that's your job, is to facilitate the in-between both offices. And then, of course, you want to document according to your clinical facilities policy. Every facility is different. Every doctor's office has their own set of expectations on their medical assistants, and that's something that you need to become familiar with in that situation. So, after the exam, here's what you do. You might have to assist in additional screening tests. Maybe the doctor said, hey, get a flu swab on room 3. Or maybe they said, hey, get a COVID test in room 2. You know what I mean? These are all your responsibilities. Collect urine from room 4 and send them home with a container so they can collect their stool and bring it back in so we can test it for ova and parasites, okay? There's a whole table on table 38-1 in your textbook that lists additional screenings and tests that you might be responsible for. You want to help your patient down from the exam table. Why is that? Why is that important? So they don't fall. Because if they fall, that becomes a liability, which means you can get sued. You want to answer their questions because you don't want a patient to leave your office not knowing what the next step is. As patients, right? Have you ever experienced a time where you've left an office and you're like, what am I supposed to do now? Like, I have no idea what's going on. I feel like I've lost brain cells. You don't want that for your patients. So what you do is you talk to them. You make sure that they understand before they leave what the next step is, right? And that's it. That's all we're going to talk about today for physical exams, okay? Questions?